And I learned, like, probably to this day, like the most I've learned at like a clinical rotation. Like it was so much. And it was all because I just said, hey, do you need help? Like I'm free. Do you need help? And then you just ask the questions. I mean, you're a nursing student, you're at clinical, you're not supposed to know everything, right? You're not supposed to. So asking those questions is so, so helpful. And it also, on the other side of it, as like the nurse helping a nursing student, if that nursing student isn't asking questions, I'm concerned.
Okay, hello. Welcome to the Nursing School Show. This is a little bit different than what you are probably used to on this channel because, well, we've never had Nicole here before. Or I don't actually think, Nicole, we've brought any guests on ever, other than Matthew, but he's always sitting next to me. Anyway, hello. My name is Christina. I am a registered nurse. If you have not been here for a while, welcome. Welcome to our channel. And this is Nicole Palmer.
Hi.
Are you going to be on this side of me or this side of me?
Well, sure.
I don't know.
On mine, you're over here, but we'll see.
So this is Nicole. She is the lead nurse on our team, and I don't know what else to say about you other than you are awesome, fantastic, and my life doesn't run without you, to be honest. How long have you been with us at NursingSOS?
I think we're coming up on 3 years, which is wild.
That's amazing. I cannot believe it's been 3 years. So here's what happened, friends. I started writing this video on confidence in nursing school, and I was like, this is not, like, I can totally talk about it, but I think it would be more fun if I brought Nicole in and we could share maybe our experiences of total not confidence in nursing school, just so all of our nursing students don't feel as alone. Because let's be honest. Okay, so here's the problem. Kind of a little bit of my soapbox for nursing school, because when you get to nursing school, Nicole, you probably had this experience 1,000 times. It just feels like everyone knows what they're doing, but you're the only one that doesn't get it. It's so like you go into an exam and everyone's like, yeah, I got this, and you're like,
no, I have no idea what I'm doing.
I don't know what's happening. You're not alone. So I think that's probably the biggest nursing school lie, right? Is that everyone else gets it except for you.
Exactly.
I don't know. It's just a little bit scary. Anyway, so it's kind of a long introduction to Nicole. Nicole, do you have anything you want to say about yourself that's kind of fun?
All right. So let's see. So I went to nursing school 10 years ago. So it's been a little while, but I fully remember that feeling of walking into my first exam and walking out being like, what just happened? Like totally blindsided, feeling like I have absolutely no idea what I'm doing. I cannot be a nurse. There's no way. And then, I mean, not to say that that feeling went away with every exam, but it started to become more normal. And over time, I started to feel like, okay, maybe I do know what I'm doing. So
takes a while
to talk about this, right? Because I feel like it's just so common. And like you were saying, it's just one of those things that nobody talks about because everyone's scared that they're the only one feeling that way. But you're not.
I think it's definitely something that needs to be normalized. Like we need to normalize not being okay in nursing school, or like not like not knowing things. I think that that's really the thing is like, maybe you're just expected to know so much right from the start, and or at least that's how it feels, right? Because like you're handed 1,000 textbooks and they're like, okay, exam next week on your 1,000 textbooks. And I was like, what? Like I feel like I should have known this, you know, we should have been studying already for the past 3 years for nursing school, right?
Yeah,
so
exactly.
You feel like you're supposed to know everything, but that's not the case. Like we talk a lot here on this channel about critical thinking, right? Nicole, you've heard me say 1,000 times. That when you get to nursing school, it feels like everyone expects you to know how to critically think, but nobody teaches you what critical thinking is or how to do it or anything about it. You're just supposed to know it magically. Like the confetti falls from the sky and all of a sudden you're a think like a nurse rock star. That's not the reality. So I really think this idea of confidence in nursing school and just the fact that no one else knows what's happening just needs to be normalized. Like we need to
Yes.
talk about it more. So that's actually it's exactly why I brought you in here because like I think that the more that nursing students can hear from other nurses or other
Yep.
students to say like, hey, by the way, I felt the exact same way and you're not alone. And yes, it does really stink when you start
Yep.
nursing school. It's kind of the worst, but it does get better,
It does.
right? Like you said, Nicole, it does get better.
It does.
Do you feel like did you ever have a moment in nursing school where you felt like I got this?
No.
Me either.
No. And I mean, I still feel like even as a nurse, you have those days where you're like, what's going on? What am I doing? Like it's like just this constant learning experience and having to trust that you really do know what you're doing and you really are learning. But
Yes.
I know, not to say that I didn't know what I was doing and totally felt like I didn't know what I was doing, but if you take a second to like think back on where you were, it helps to remember like, okay, maybe I do know some things.
Yeah, absolutely. Like, yeah, that's a really good point. Like thinking back, like, okay, let's say, so we have nursing students obviously in like fundamentals or med surg or in specialties like OB, taking OB classes or pediatric classes. So you really have to that's a good practice kind of a habit to get into is
Hmm.
to like think back, oh wait, like I did pass microbiology
Yep.
before starting nursing school, or I did pass A&P, and that
Yep.
was just basically a dumpster fire the whole time, so like
Exactly.
that was the worst. I can get through this kind of thing. Like think back to where you were,
Yep.
3 years ago, 5 years, 10 years ago. I mean, how long, Nicole, did you want to be a nurse? Like, how long were
Right.
you actually pursuing this?
Yeah. I mean, it's one of those, and I think it's for a lot of people. Like, it's just something you grow up as a little kid being like, I'm going to be a nurse. And for
Mhm.
no other reason than just, I'm going to be a nurse. I mean, your story is so unique because you had that like pivotal moment.
That's true. I did
But
not want to be a nurse until, yeah.
right?
But for you,
But
did you grow up as a little kid wanting to be a
yeah.
nurse?
Well, so I wanted to be a doctor, and then my parents were very smart and said, "Let's shadow some nurses." So
Cool.
I just kind of surrounded myself with other nurses, and it just kind of fell into place. But I feel like it is one of those things where a lot of people just grow up, and that's what they want to be, and then they get to school, and they're like, "Do I actually want to do this?" Because it feels so challenging.
Yeah,
But
and well, I mean, we get emails all the time from students, right, who are like,
yeah,
I can't do this. I don't
exactly.
think I can, like, I don't think I have what it takes. And that I think we get stuck in that place a lot where you need to go back. Like you need to go back
Yep,
and think, what, wait, I did pass A&P, like we said, I did
exactly.
pass those really difficult prereqs. And hey, now I'm here. And yes, this is hard, but I know that I can do it kind of a thing.
Exactly.
It's huge. And I think I want to go back to something that you said
Uh-huh.
just a couple minutes ago about like, you get some practice after your exams and you get a little bit better each time.
Yep.
And I think that's a really good point. You do get better,
Yes.
but so like you do like when you're taking nursing fundamentals, you don't know what you don't know. Like you don't
Exactly.
know anything, like thinking back, right? Like our first exams,
Yes.
like our stories are so similar.
Yeah.
Like you didn't know anything and you left your exam thinking like,
Yep.
what in the
What
world
happened?
just happened? Same with me.
Yeah.
You just leave. I had the biggest headache after that first day
Oh,
of nursing school, like the biggest headache.
yep.
I don't know what happened.
Hmm.
But then you get practice. Like you get practice. Maybe it's just like you get practice stressing out all the time, then you just
Yeah.
get more used to the stress, I guess. I
It
don't
could
know.
be. Or you just get used to feeling like, okay, this is normal. This is normal. I should feel this way.
Yeah, right. It's like you don't want anyone to feel that way, but it's almost kind of true. Like, okay,
Yeah.
like, I can handle this, kind of thing. Like, you just get more experience with it. You get more
Yep.
experience with how your instructors test. You get more experience with how clinical goes and everything throughout
Hmm.
the term. But then, here's the but, is that then you move on to another term,
Yep.
and then it like elevates, right? So it's like you're in
Exactly.
nursing fundamentals And then what did you have after fundamentals? Do you remember
We
what
had
class?
fundamentals and then we had med surg. So it was right from like
Right away?
the very basics, and then they throw you in like head first, and they're just like, okay, so this is what you actually don't know, but let's
Here's
learn it.
what you don't know. Everything.
Exactly.
Right? Oh man, 0 to 60 right away. That's funny. So
Yeah.
in our school, actually, we had, if I remember right, it was a while ago,
Mhm.
fundamentals, and then we went into pediatrics. So we
Yep.
did pediatrics before we did med surg. So
Okay.
we did peds and
That's
mental
great.
health together.
Uh-huh.
And then we did med surg, and then we had an advanced. So we actually had 2 mental health classes. We had an intro mental health class with peds, med surg, and then we did an advanced mental health class toward the end, and then like leadership and delegation and all those things. That was how our program ran. So I guess we had 2 terms of kind of little bit easier stuff. Didn't make med surg any easier.
No.
So that's really what happens is like you get, or at least from my experience, I don't know, tell me yours, but in fundamentals, like, those first exams are like the worst. And then you get a little more used to it because you get more used to how your instructors teach, how they test, how clinical goes. And then you get to med surg and you have a new clinical site.
Exactly.
You have new instructors. You have way harder exams. And then it's like this whole feeling of overwhelm and stress all over again.
Exactly.
Like get through. It's just a whole nother level. Is that how you experienced it too, or is that totally just me?
No, that's exactly how it goes. You feel like you're just getting the hang of it, and then you go off on break and you come back and it's like, no, you don't. Like, it's I don't think that they mean to do it, and I think that it's just kind of the nature of nursing that it feels like it's so much, and it just feels like it's like, how am I going to learn all this? But when you take a step back and you think like, what am I learning about, right? We're learning how to take care of people, other people. So it is a lot, and that's not to be taken lightly. So I feel like when you start thinking about that a little bit and just think about where the actual, like, where's your end goal? What's the end goal? You want to be a nurse, and what does that mean to you? It really can help kind of put it in perspective. Like, yes, I'm learning all these things and they're so super hard, but like, I can do this because I'm going to be a nurse at the end of it. I don't know, that always helped me, and that helped me be like, okay, I can do this. I did this and I'm going to keep doing it. And yes, it's going to keep getting harder, but I'm going to keep doing it.
Yes, it's going to keep getting harder. I'm just going to prepare myself now for that.
Right.
It really, I mean, it's so true. And you just have to, it's like we're adaptable, right? So nursing students, especially, I think we're especially good at this, is adapting. And actually you really, like we were saying, like fundamentals to med surg to, advanced med surg or critical care, like you level up, like you have to level up
on it.
Build on it every time, because it's not the same, so like if you're in med surg right now, to all our nursing students watching this, if you're in med surg, congratulations. Like think back to where you were in fundamentals and like really think back, like what were you thinking? No, what were you thinking in fundamentals, right? Like what was going through your mind when you were in fundamentals? For me, it was like all these things, like I can't do this. This is so hard. I'm never going to pass. I'm never going to be a nurse. I remember literally sitting in class. I was the first week of school, and all the instructors wanted us to tell them, okay, why do you want to be a nurse? Like, why are you here? What made you decide? And I'm like, I'm thinking in my brain, I don't think I belong here. I don't know. It's just like this total like brain freeze. Like, I don't think I can do this. And I literally like still remember that. I still remember them going to all the students like, why are you here? And I'm like, I don't know why I'm here. Do this.
I thought I wanted to be a nurse, but I don't actually know. Now I'm here.
No anymore. This is so hard. And so it's just, you have to think back, like Nicole said, like think back to how far you've come. Really find that motivation inside of you to keep going, because you've done it. Like you've done it before. you got through A&P, you got through, I always say A&P and micro because that was hard for me.
Yes, me
Biology,
too.
like all the tough, man, parts of a cell. I don't know.
I
We
know.
have to learn that in biology. Come on. So like all the things you had to go through before. Now
Yeah.
you're here. You're in fundamentals, or you're in med surg, you're in OB, peds,
Yep.
mental health, what have you. You made it. Like you got
Exactly.
through that. You can do
Mhm.
this. But it is hard. And I think
It
like
is.
the more that we practice, the more confidence you get, the more motivation you will have to keep pushing forward. I guess that's kind of the moral of the story, huh, Nicole?
Yeah. Yeah. I mean, as you do it more, it becomes more natural and it starts to feel more like, okay, maybe I do know what I'm doing. I think like you were saying, the key thing is to keep checking back in. Like think about that first day. I'm sure we all have like literally that first day stuck in our heads because it feels so overwhelming.
It's like
Um,
trauma,
it
almost.
is.
It's like trauma.
It really does feel like it. But I think if you think back to that and you may like feel like silly about how much you thought you knew and how hard it all felt, but then you look at it and you're like, okay, but I got through it, right? Like I did it. I moved forward with it. I
And
feel
then
like
you
that
build
really,
confidence, right? You
yes,
build confidence because of that. You build
exactly.
confidence as you get practice and as you
Yep.
just keep moving forward and don't give up, right? Like
Yes.
as
Yeah.
long as you just keep pushing forward, keep moving forward, keep trying, keep practicing, keep failing, keep moving forward, even if you like make a mistake, like
Yep.
learn from it and move on and keep going, just keep
Mhm.
practicing, just don't give up. Then,
Exactly.
a year into your nursing program, 18 months if you graduate with an advanced, or not advanced,
Accelerated.
accelerated
Yep.
program in 18 months, or if your program's 2 years or 4 years, what have you, you're going to look back and say, wow, like I came
Did
a
it.
long
Yep.
way. You're going to know a lot more in 4 years, in 5 years, in a decade than you do now.
Exactly.
It's just how it works. But you can't give up. You
Exactly.
have to keep pushing forward. You have to keep moving no
Hmm.
matter what. Now, something else just real quick that I wanted to mention with confidence,
Yep.
kind of along the same line. Nicole, I know we get a lot of emails and comments from our NursingSOS members, and we get a ton of DMs about this on
Yep.
Instagram. Is clinical and
Exactly.
building confidence at clinical.
Hmm.
And I think what I always say, and I know you do too,
Yep.
really our advice has always been to just is exactly that. Raise your hand, do
Yep.
all the stuff, make mistakes, fail
Exactly.
over and over and over again,
Yes.
and keep practicing. You
Yep.
cannot stop practicing, because if you
Exactly.
stop practicing, your confidence is going to stagnate.
Hmm.
The more practice that you get, the more confidence you're going to get. Has that been your experience as a nurse and
Yes.
as a nursing student?
Yes, definitely. I feel like that first clinical is the part where that stands out too in my mind as like one of those like traumatic moments because you feel like you're thrown into it. You're just kind of like, okay, these are real people, these are real patients, and I'm supposed to know what I'm doing. Like
And I
it's that
don't.
exactly, it's that whole feeling of like, how am I going to know how to do this?
I
Um,
know.
but I mean, the easiest thing to do, I'll never forget one clinical day I had where I like offered to go help another nurse. And I learned, like, probably to this day, like the most I've learned at like a clinical rotation. Like it was so much. And it was all because I just said, hey, do you need help? Like I'm free. Do you need help? And then you just ask the questions. I mean, you're a nursing student, you're at clinical, you're not supposed to know everything, right? You're not supposed to. So asking those questions is so, so helpful. And it also, on the other side of it, as like the nurse helping a nursing student, if that nursing student isn't asking questions, I'm concerned. I'm thinking,
Yes.
oh boy, why,
Thank
what,
you and amen.
right? I mean, I want to know that you're thinking, I want to know that you're putting it all together and you're trying to like make sense of it all. So that is something that is going to benefit you to ask all those questions, offer to help, but also it's going to make the other nurses be like, okay, she knows what she's doing. right?
That's
Even though
what I
you
was
feel like you
supposed
don't,
to
you really,
do.
in the nurse's eyes, you look like you know what you're doing. And I mean, it just will go so far. But that clinical day, that first clinical day definitely stands out as a traumatic event as well.
No kidding. Oh, it's just and every subsequent term too, because
Yep.
your clinicals, well, I don't, at least for
Change.
me, yeah, they change, right?
Yeah.
Yours changed. I mean, we started in a long-term care,
Yep.
like was it long? It wasn't actually long-term care. It was technically skilled nursing. And
Yep.
then I think depending on what state you're in, it kind of, has
Varies.
different names. But I kind of a step down,
Yep.
unit type thing. Rehab facility, some places call it, but that was kind of ours,
Hmm.
like skilled nursing. And then you move on to like the hospital setting, and
Yep.
then if that's what your school does, work in a hospital, or you work in a clinic, or where else was I at? I was at you know um
The community health stuff.
community health stuff.
Yep.
Exactly. You could be like at a vaccine clinic, you could be at
Yep.
like different places, and every time your comfort zone is going
Yep.
to expand.
Exactly.
You're gonna freak out initially. You're like, oh, I've
Uh-huh.
never been here before. Like, I was on it was a rehab floor, but it was still in a hospital. I'm like, I don't know what I'm doing. I've never
Exactly.
done this before. So then you get more confident. the
Yep.
more the more experience you get in different settings, the more you
Hmm.
go through nursing school, and practice, like we said, practice. And like Nicole said, like you said, Nicole, raise your hand.
Yep.
Raise your hand and ask questions. The same thing
Hmm.
for me, having students. I always tell them, it's like, I am
Yes.
not worried about you if you are trying and asking questions.
Exactly.
The students that I am worried about are the ones that tell me that they got it and they know it all.
Exactly.
Like, don't touch my patients.
But that all goes back to that feeling of when you get into nursing school and you start going to those classes and just feeling like, how do I know it all? But you like, it all builds on each other. So if you feel like you know it all, you haven't scratched the surface. Hate to
You
break
have
it to
no
you.
idea. You don't know what you don't know, man.
Right. Exactly. I feel like I mean, I just feel like that's important. And maybe that's like just another way to frame it. Like if I felt like I knew it all, I wouldn't really know as much as I do. Yeah.
Absolutely. Because you're not going to be open to like asking questions, raising your hand, and
Hmm.
taking the risk, taking the chance. Like, do you remember your first IV start on a real
Yep.
hand? Me too.
Shaking and like,
Shaking. You're like sweating through your gloves. There's
yep.
blood everywhere. Like, oh, this is not going
I
well.
had a awesome like clinical instructor, and my patient had actually said, "Oh, like is it like her first time?" And she was like, "No, she's done it before." I was like, "Ah,
On a mannequin.
right."
Wink. No kidding. Actually, we had a nursing instructor who said that same thing. She said,
Yeah.
if any patients ever ask you if you've done this before, just say yes.
Yep.
On a mannequin.
Right? You practiced
1,000
it.
times. Wink. I got this. Yeah, but no,
Uh-huh.
it's so true. I mean, gotta keep your patients calm, man.
Exactly.
Well, I gotta tell you, okay, this has nothing to do with confidence, basically, but I want to tell you the story really quick, Nicole. I don't think I told you about this.
Okay.
We just had a baby, you know that.
Yes.
Everyone else in YouTube land, we just had a baby. I didn't show you, but the IV start, literally, like the first one,
Oh.
totally blew out my vein. It hurt so bad for like 2 weeks afterwards. It was all swollen, and like literally, I have a picture. I should show you, Nicole, because
Yes.
it was the worst. It was the worst IV start I've ever had.
Oh gosh.
Probably the worst I've ever seen.
Yeah.
I mean, I was in labor, so I didn't see her actually do it.
Yeah.
But it was bad. Like my whole hand was swollen. So moral of the story, friends, that happens. I mean, that was a nurse, probably been a nurse for years, and it happens. Like even as like seasoned nurses, you will still make mistakes. Like you will still blow a vein, you will still mess up. Do not expect that you are just gonna know like when you graduate nursing school, the same thing. you don't know anything. You don't know what you don't know. And so you just have to keep pushing forward. Like, you just have to keep going. You're never, like, none of us are ever going to hit this magical stage in life where we suddenly have it all figured out. That is not reality. That is not how God designed the world. That is, like, we are always constantly learning, constantly growing. That's just how it is.
Exactly. Especially in nursing. You never will feel like you know it all, ever.
It's always
You just keep learning.
It's always changing. So we're like, okay,
that's true.
adapt to this. Let's go. So, anyway, moral of the story, practice. I think that's kind of where it's, isn't that kind of like, if we were to recap this, Nicole, would it be like
and to feel uncomfortable, to be okay with feeling uncomfortable, right?
Yes.
Like, be okay with being out of your comfort zone. You're doing something right if you're like uncomfortable.
Yes. If you're uncomfortable, you're doing it right. That's funny. Yeah, it's so true though, because I mean, there's no other option. The only other option is to stay in your little bubble, not learn, not take any chances, not grow. Exactly. And that's not what we are supposed. You're gonna graduate nursing school like actually not knowing anything after that.
Exactly.
Like, you want to level up, like we said, every time. Like every new term, you're gonna learn more and you're gonna learn more and you're gonna learn more. You just can't stop. You cannot stop. So wow. Anyway, if this was helpful for you, let us know in the comments, because this was super fun. I don't know, Nicole, was this super fun for you?
It was great. It was perfect. I loved it.
It's just so helpful for students to see nurses, other nursing students, like, just be real about what is going on. Because especially when it comes to a topic like confidence, we really have this assumption that everyone else knows what they're doing, and it's just simply not true.
Not at all.
Not at all. Like, Nicole and I have been nurses for years. You don't know. Like, we don't know what we're doing half the time.
Exactly. It's okay.
So, I think that the more that we can be real about these things, then the more pressure you can take off yourself, or like not gonna say lower your expectations, but kind of in that way, lower your expectations. Like, don't expect that you are gonna get that acceptance letter to nursing school and suddenly have all this knowledge, or that you're gonna pass your med-surg class and suddenly feel like, oh yeah, I get it, or even graduate nursing school and feel like you're prepared in any capacity to be a nurse. It's not usually how it goes. So I guess just kind of normalizing those things. Let us know if this video and this conversation was helpful for you in the comments. We've never done this before, but I think it would be super fun to do more often about other topics. What do you think, Nicole?
Definitely. Yeah. If anybody has any suggestions, let us know.
On what topics to cover? Absolutely. I have some ideas. I know you do too, Nicole. We've talked, but I think that it will be. I just hope this was helpful, for sure. And I think it was. I don't know. It's helpful for me.
Me too. It's helpful to just hear another person be like, "Oh yeah, it's hard."
Yeah, it's hard. It's kind of the worst, but you can do it. We can do it together. That's so funny. Well, thanks so much for hanging out with us, Nicole. Yay! Yay! All right, bye everybody on YouTube.
Bye.
Bye. Thanks for hanging out with us. See you later. Oh yeah, subscribe and hit the bell. Ding. Bye.